You know that feeling when you're completely numb inside, when nothing seems to matter anymore? Well, it turns out your body might be trying to tell you something. Today, we're diving deep into the fascinating connection between addiction, our physical health, and emotional well-being. Specifically, how healing our liver, gut, and soul might be the key to breaking free from the cycle of numbing ourselves.
And it's such a critical topic because we're seeing this huge increase in alcohol-related health issues, particularly liver disease, which has more than doubled in the US over the last 20 years.
Wait, doubled? That's alarming. What's driving this increase?
Well, according to recent research, there are four main groups showing increased heavy drinking: women, adults over 45, people living in poverty, and those with metabolic syndrome. And what's particularly concerning is how this affects women. They're actually more susceptible to alcohol-related liver disease than men.
That's fascinating. Can you explain why women are more vulnerable?
It comes down to biology. Women typically have less water weight and more body fat, which increases blood alcohol concentration. They also have lower levels of an enzyme called alcohol dehydrogenase that helps metabolize alcohol.
So their bodies literally process alcohol differently. But let's talk about what's happening in the gut when someone drinks regularly.
This is where it gets really interesting. Alcohol disrupts the balance of bacteria in our gut microbiome. It increases harmful bacteria while decreasing the beneficial ones that help with digestion.
And what does that imbalance lead to?
It can cause something called leaky gut. Think of your intestinal lining like a brick wall. Alcohol creates cracks in the mortar between the bricks, allowing bacteria and toxins to leak into your bloodstream.
Such a clear visual. And I imagine this affects more than just our physical health?
Exactly. There's this fascinating connection between gut health and mental health. The bacteria in our gut actually produce neurotransmitters that affect our mood and emotions.
So, when we damage our gut with alcohol, we're also potentially affecting our emotional well-being?
Precisely. And this creates a vicious cycle. People often drink to numb emotional pain, but the drinking itself can worsen emotional health through this gut-brain connection.
Let's talk about that numbing effect. Why do we do it?
Well, emotional numbing is actually a defense mechanism. Our brains try to protect us from overwhelming feelings by shutting down our emotional responses.
Almost like an emotional circuit breaker?
That's a great analogy. And while it might provide temporary relief, over time it can lead to feeling disconnected from ourselves and others.
And I imagine alcohol just amplifies this numbing effect?
Absolutely. It's like a double whammy. We're emotionally numbing through the psychological defense mechanism and physically numbing through the alcohol.
So how do we start healing? Where do we even begin?
Research shows that a holistic approach is most effective. This means treating the person as a whole, addressing physical, mental, emotional, and spiritual aspects simultaneously.
Can you give us some specific examples of what that looks like?
Sure. It might include traditional addiction treatment combined with nutritional therapy to heal the gut, mindfulness practices to process emotions, and physical exercise to support overall health.
I've heard there are some exciting new developments in gut health treatment. Something about postbiotics?
Yes. There's fascinating research showing that postbiotics, which are beneficial compounds produced by beneficial bacteria, might help repair the gut barrier and reduce liver inflammation.
That's incredible. What happens to the liver when someone stops drinking?
The liver has an amazing ability to regenerate. Research shows that even after just 7 days without alcohol, you can see reductions in liver fat and healing of mild scarring.
Only 7 days? That's remarkably quick.
Yes, and the benefits continue. After a month, studies show significant improvements in insulin resistance and blood pressure.
What about emotional healing? How long does that take?
That varies more person to person, but research indicates that most people start feeling better emotionally after 1 to 2 months of sobriety, even heavy drinkers.
And I imagine sleep improves too?
Absolutely. While alcohol might make you feel sleepy initially, it actually disrupts your sleep cycle. Within a week of stopping, many people report better quality sleep and more energy.
Let's talk about the spiritual aspect of recovery. Why is that important?
Life transitions, including recovery, often serve as catalysts for spiritual growth. They're opportunities to realign with our authentic selves and find deeper meaning.
So it's not just about stopping drinking, it's about transformation?
Exactly. It's about healing the whole person and discovering who you are beyond the addiction.
What role does mindfulness play in this process?
Mindfulness helps us stay present with our emotions instead of numbing them. It's like building a new relationship with our feelings.
And that probably helps prevent relapse too?
Yes, research shows that mindfulness-based approaches can significantly reduce relapse rates by helping people identify and cope with triggers.
Speaking of relapse, Isn't that a common part of recovery?
It can be. The research shows that relapse rates for substance use disorders are similar to those for other chronic conditions like diabetes or hypertension.
That's an interesting comparison. It helps normalize the recovery process.
Right, and just like with other chronic conditions, a relapse doesn't mean treatment has failed. It's a signal to adjust the treatment approach.
Let's talk about support systems. How important are they in recovery?
They're crucial. Research consistently shows that people with strong support networks have better recovery outcomes.
And what about professional help? When should someone seek that?
The earlier, the better. Sadly, statistics show that only about 10% of people who need treatment for substance use disorders actually receive it.
That's a staggeringly low number. What stops people from getting help?
Often it's stigma, denial, or not knowing where to start. But treatment options have come a long way, with many evidence-based approaches now available.
Like what? Can you give some examples?
There's medication-assisted treatment, cognitive behavioral therapy, holistic approaches like nutrition and exercise therapy, and various support group options.
And these can all be tailored to the individual?
Absolutely. The most effective treatment plans are individualized, taking into account a person's specific needs, circumstances, and goals.
What about the cost? Isn't treatment expensive?
While cost can be a barrier, many insurance plans now cover addiction treatment, and there are often sliding scale options available.
That's good to know. What would you say to someone who's listening right now and wondering if they need help?
If you're questioning whether you need help, that's often a sign that you do. And it's okay to reach out. Seeking help is a sign of strength, not weakness.
And the sooner the better, right?
Exactly. The earlier you address these issues, the better your chances of preventing serious health complications.
What's the most important thing for people to remember about recovery?
That healing is possible. The body has an incredible capacity to repair itself, and with the right support, people can and do recover.
And it's about more than just stopping drinking.
Much more. It's about reconnecting with yourself, healing your body, and discovering a new way of living.
Well, this has been incredibly informative. Any final thoughts?
Just remember that numbing might provide temporary relief, but true healing comes from facing our challenges and getting the support we need.